Sa hugis ng aking muka, bukod tanging katangian, ngunit hindi ito hadlang sa aking wagas na pagmamahal. Ito marahil ang kaibahan, iba kami sa karamihan. Ano mang galit, kami na kung magmahal, wagas ang paglalambing. sa mundo. Sa pag-ibig ng magulang ko, tadhana ang gumalaw. Sa kondisyong umibabaw, pero kahit na papano, mahal ako, alam ko. Sa hugis ng aking muka, bukod tanging katangian, ngunit hindi ito hadlang sa aking wagas na pagmamahal. Ito marahil ang kaibahan, iba kami sa karamihan. Mga tanging nilalang na hinatid mula sa langit, kaming hindi nag-iipon ng kahit anumang galit. Kami na kung magmahal, wagas ang paglalambing. Hindi kami nag-iisa, kasama namin aming pamilya. At sa aming pagtanda, sinasabing sumusuporta. Pag kaming nagayak, pami-pamilya'y sama-sama. Mga tanging nilalang na hinatid mula sa langit, kaming hindi nag-iipon ng kahit anumang galit. Kami na kung magmahal, wagas ang paglalambing. Mga tanging nilalang na hinatid.
Magandang hapon po sa inyong lahat and welcome to the Down Syndrome Association of the Philippines 3rd Kapihan with the topic Psychiatric Problems in Persons with Down Syndrome. Ako po si Cesar Baltazar, your host for today. A proud father of our bunso. Ang pangalan niya ay RB, who has Down Syndrome. At kami po ay matagal ng miyembro ng DSAPI, 27 years. So, napakarami po natin ngayon, no? Sa FB Live, no? And YouTube. At sa palagay ko ay magiging masaya ang ating pagtitipon ngayong hapon. Hello, everybody! Ngayong hapon, isa na namang mahalaga at exciting event ang mangyayari. Magkakaroon tayo ng talakayan sa usaping psychiatric problems in persons with Down syndrome at kung paano mabibigyan lunas o matutugunan ang mga problemang ito. But before anything else, siguro inanyanya ko kayong manahimik, manandali as we invite you to our opening prayer and invocation.
Bawat huningang ibon sa pag-ihip ng amihan
At ngayon naman ay aking tatawagin ang presidente ng DSAPI to formally welcome everybody at upang magbigay linaw kung bakit napakahalaga ng ating pagtitipon ngayon. President Luis Harder.
Magandang hapon, Sir Cesar, and thank you for that very nice introduction. Magandang hapon sa ating mga audience na nandyan sa FB at na FB Live at sa YouTube. At welcome po dito sa ating lecture webinar ngayong hapon na pinamagatan nating Psychiatric Problems in Persons with Down Syndrome. Naisipang gawin ng DSAPI ang program ngayong hapon dahil sa palagay namin ito napapanahon na. No? Una, marami kami nababasa ng mga posting sa ating FB page, sa FB page ng DSAPI, tungkol sa ating mga miyembro na mayroong Down syndrome, meron silang sleep disorder, o kaya sinasaktan ng sarili, o nananakit ng iba, at iba't ibang uri ng unusual traits, ano. Naririnig din natin mga kwento ng ating mga kaibigan at ibang members natin tungkol sa kanilang anak at mga kapatid, anak o kaya kapatid na meron din ganun, no? Kakaibang mga personal traits, no? Very unusual personal traits. At naranasan din namin ito sa aming anak na si Adeline Lois, na si Adeline ay tawag dito. Marami siyang alam gawin, and she goes to school, and maganda yung kanyang development maski meron siyang Down syndrome. Kaya lang all of a sudden, bigla siyang nagkaroon ng pagbabago sa kanyang personality, no? Naging matamlay, hindi makapagtulog, o kung makatulog man, minsan nagigising sa disoras ng gabi. At nagkaroon siya ng regression. Parang unti-unti nawawala yung kanyang mga skill sets na na-develop sa tulong ng kanyang mga therapist at kanyang pag-aaral, no? And nagkaroon siya ng mga audiovisual hallucinations and things like that, no? So, itong karanasan na to, biglaan ito nangyari sa amin, and we didn't see this coming, really. So kami ay nabahala at nalungkot kami at nagalit dahil hindi namin maintindihan kung ano nangyayari kay Adeline Lois. So siguro ganun din yung mga nararanasan ng ibang members natin na merong halos kahawig na karanasan sa kanilang mga anak. Dahil nga naging helpless kaming mag-asawa sa sitwasyon ni Adeline Lois, naisip namin na kailangan natin ng professional medical help, no? At doon namin nakilala yung ating resource speaker ngayong hapon, at nagpapasalamat kami sa kanya na malaki dahil nagpa-unlock siya na maging resource speaker natin ngayong gabi. At hindi lang yan, malaki ang naitulong sa atin, sa aming mag-asawa, lalong-lalo na kay Adeline Lois, malaki ang naitulong ng ating resource speaker ngayon. Naliwanagan kami kung ano nangyayari kay Adeline Lois, at unti-unti nakakita kami ng improvement kay Adeline Lois, no? So, ang objectives natin ngayong hapon ay maintindihan ng mga magulang kung ano yung nangyayari sa kanilang anak, no, na mayroong Down syndrome, sa pagpapaliwanag at pagtuturo sa atin ngayong hapon ni Doktora, hindi ko muna sasabihin yung pangalan. Hayaan na natin si Sir Cesar niyan, ano? At mapalaya tayo sa pagkabahala at pagkalito, at magabayan tayo ng ating resource speaker kung ano ang mga dapat nating gawin para sa ikabubuti at kagalingan ng ating mga anak. Sabi nga, the truth shall set us free. Okay, no? At nagpapasalamat din tayo ngayong hapon sa ating sponsor para sa webinar natin ngayong hapon. Walang iba kundi si Fe Cruz, ang kanyang anak na si Jonathan at si Patrick, no? Maraming salamat, Ma'am Fe, for sponsoring this webinar ngayong hapon. And we welcome sponsors to do this, no? companies or families, you're welcome to become a sponsor of the forthcoming webinars of the Down Syndrome Association of the Philippines. So yun lamang po, stick around at maraming salamat sa inyong pagdalo ngayong hapon. God bless us all. Back to you, Cesar.
Salamat, President Luis. Now, let's get ready for the Kapihan. Sapagkat ito'y Kapihan, siyempre ako ay mayroong kape. Sandali po lamang. Okay. Gaya nga na sinabi ni President Luis, meron tayong dalawang objectives today. No? First, gusto nating mabigyan lahat kayo ng pagkakataon na marinig ang latest na kaalaman sa larangan ng psychiatric problems in persons with Down syndrome. At pangalawa, magkaroon tayo ng pagkakataon na masagot ang mga ilang katanungan na maaring mayroon kayo, no? At magpalitan ng kuro-kuro o opinion o eksperyensya sa topic na ito. So yun po ang ating two objectives. So ganito po ang magiging programa natin. Una, magbibigay ng presentation lecture yung ating guest speaker na isang dalubhasang psychiatrist. I will introduce her in a while. Habang nagsasalita po ang ating guest speaker, pwede rin namang yung isulat doon sa comment section ang inyong mga comments or questions, kung meron man, upang matugunan pagkatapos ng lecture. Pangalawa, magkakaroon tayo ng open forum pagkatapos ng lecture. Kung saan pwede kayong magtanong o magkomentaryo sa inyong narinig. Sa puntong ito, meron din po tayong isang panel composed of 3 parents of persons with Down syndrome na akin pong tatawagin during the open forum upang magkomentaryo sa mga bagay na dinidiscuss natin sa open forum o di kaya ay magbahagi ng sarili nilang experience sa kanilang anak sa usaping ito. Ang panel members ay sina Presidente Luis Harder at father din siya ni Adeline sa pagkakakwentungan niya, no? 11 years old. Ang second panel member ay si Ed Sanchez, Vice President ng DSAPI for Healthcare Programs, and father to Mickey, who is 30 years old. And the third panel member is Malu Ortiz, former Vice President din ng DSAPI, at mother to Clarissa, who is 34 years old. So yan po ang ating panel. At ngayon, dadako na ako sa introduce ko na ang ating guest speaker. No? Siya po ay isang medical doctor, psychiatrist, na nagtapos ng medicine sa University of the East, Ramon Magsaysay Memorial Medical Center. Nag-residency in General Psychiatry sa Medical City Hospital. Kumuha ng fellowship in Child Psychiatry sa Philippine Children's Medical Center. At sa kasalukuyan, siya po ay President ng Philippine Society of Child and Adolescent Psychiatry, Chairman or Chairwoman ng Department of Psychiatry, St. Luke's Medical Center Global City, Training Officer, Section of Child Psychiatry, the Medical City, at co-leader ng Special Interest Group of the World Psychiatric Association, particularly for psychotherapy for youth, since 2019 hanggang sa kasalukuyan. Ladies and gentlemen, let's give a warm welcome to our guest speaker and expert, Dr. Vanessa Kathleen Kainghug.
Hello, thank you po, Sir Cesar, for the introduction. And I would also say thank you to Sir Luis, the President of DSAPI, for a very warm and interesting introduction of the topic. Okay. Uh, I am also thanking everybody for inviting me for the first time to your group, because I have lectured or talked to various groups, to numerous schools, different organizations, but this is the first time that I'm talking to DSAPI. So I'm not going to delay. I'm going to start my lecture. This is going to be a short lecture. Okay. How do I show my slides? Are you now looking at my slides, Sir Cesar? Ayan. Okay po. Uh, Actually, the title of my talk is Common Psychiatric Problems in Children with Down Syndrome, or we call this comorbid, because there is a primary condition called Down syndrome, and there is another condition which is psychiatric. So we can say that they are comorbid. Okay. Now, uh, I know that all of you are familiar with the definition of Down syndrome, but for the benefit of those who are not yet aware of the official definition, I'd like to review muna the official definition of Down syndrome. So Down syndrome is also known as trisomy 21. Trisomy meaning there are three chromosome 21 in a person. Actually, we have each person has 46 chromosomes, and half of this came from the egg of the mother and half came from the sperm of the father. And then when they fuse, we get a total of 46 chromosomes. But when an egg or a sperm keeps both copies of the chromosome 21, when it fuses with the egg or the sperm, there will now be an extra copy of this chromosome. So the fertilized egg will become a fetus which has three copies of this chromosome. That's why it is called trisomy 21. Okay po. So we are all familiar about the physical symptoms of Down syndrome. These are the following: the eyes that slant upward, the small ears that may fold over slightly at the top, the small mouth that makes the tongue appear large, the nose can be small with a flattened bridge, the short neck, small hands with small fingers, two instead of three palm creases sa hands dito, including one across the palm and around the base of the thumb. Ganyan po. The short height and the loose joints. We're all very familiar with that. Okay. Now, aside from the physical symptoms of a person with Down syndrome, this person can also have a host of other medical conditions. Diba? I am sure that you have all undergone medical scares because of heart diseases, intestinal problems, vision problems. Kanina, when I was looking at the slideshow, I saw that a lot of the kids were wearing eyeglasses. So that's really a part of the symptoms of Down syndrome. A lot of them also have hearing problems, thyroid problems, blood conditions such as leukemia and risk for infections, and learning disabilities. Okay, now, uh, usually the first doctor that you will approach when you realize that something is wrong with your child or your baby is the developmental pediatrician, right? But Down syndrome is actually a complicated condition such that a team of doctors should manage your child's problems. But the developmental pediatrician can be what is called the case manager. Okay. Because when the child with Down syndrome approaches the teenage years or adolescent years, psychiatric symptoms become more common. Okay. Now, what are these psychiatric and behavioral problems in Down syndrome? Uh, a study said that about 13.17% of these children will develop a psychiatric problem. Another study said that up to half of children with Down syndrome will develop psychiatric problems. Now, these numbers will equate to so many kids with psychiatric problems, di ba? Actually, I forgot to look up the total population of Filipinos with Down syndrome, but I'm sure a lot of you know. So, if you multiply that with 50%, naku, marami po talaga yon. So, ano-ano po ba yung psychiatric problems na mangyayari sa person with Down syndrome? This can be depression, anxiety, obsessive compulsive disorder, schizophrenia, eating disorders, ADHD, oppositional defiant disorders, conduct disorders. When they get older, a lot of them develop Alzheimer's disease. They can also have autism spectrum disorder and progressive loss of cognitive skills. Okay. When the child with Down syndrome is still young, in the preschool and early school age, these are the usual psychiatric problems: disruptive, impulsive, inattentive, and hyperactive. That means these symptoms belong to the attention deficit hyperactivity disorder, or what is uh, popularly known as ADHD. ADHD symptoms can also happen in Down syndrome. And also, they can have oppositional behaviors belonging to the oppositional defiant disorders. They can also have anxiety. They can be ruminative. They can have inflexible behaviors. And this belongs to the disorder we call generalized anxiety disorder or obsessive compulsive disorder. They can also manifest with problems in social relatedness or difficulty interacting with their peers. They can be self immersed. They can demonstrate repetitive stereotypical behaviors or yung mga paulit-ulit na galaw na wala naman uh, purpose. For example, hand flapping, ganon, or jumping, ganon. These symptoms are usually found in autism spectrum disorder or pervasive developmental disorder, ASD or PDD. A lot of children with Downs also have chronic sleep difficulties or sleep problems. Okay? And let's not forget mood or emotionally related problems. Now, when the child approaches adolescence, there are more mood problems like depression, social withdrawal, diminished interests and coping skills, anxiety, again, obsessive compulsive behaviors, regression or decline in cognitive and social skills, sleep problems, and uh, this is really found in majority of cases in adolescence, the development of psychotic symptoms or symptoms of schizophrenia. I will explain this more later. Okay. Now, when the person with Down syndrome reaches adulthood, these are the common psych problems: generalized anxiety, again, depression, regression with decline in cognitive and social skills. And when they approach the senior years, dementia or Alzheimer's. And also psychosis and symptoms of schizophrenia. Okay. Now, what is schizophrenia? Schizophrenia can develop in a normal person. And this happens in about 1% of the population. So we do not know who will have it or who will not have it, but it will develop in 1%. If there are 100 people in the room, at least one will have it. Okay. The common symptoms of schizophrenia are delusions. What are delusions? These are beliefs that are very strong in a person, even if we know that this is not true. Okay, so the person believes in something, but actually it is not true. But the people around him, the family, will not be successful in eliminating that, even if kulitin ninyo yung tao, naku, hindi naman totoo yan, ano ka ba, wala naman. But the person with delusions will insist kasi it's really ingrained in his brain. Okay, now what are hallucinations? I explain hallucinations this way. Di ba each one of us has five senses? Ano ba ang senses? Sight, hearing, taste, touch, and balance. Di ba? Now, if you are hearing my voice right now, that's not a hallucination because I am talking. But if no one is there, no person is with you, and you hear a voice or keep hearing a voice, that is a hallucination. So hallucination is one of your senses perceiving something which is actually not there. And the people around you will not be successful in convincing you that it is not there because you will actually sense it. Kung auditory hallucination, you will really hear the voice. Pag visual, you will see. Pag taste, you will taste. Pag smell, you will really smell. Actually, this is very common in people who experienced a recent death. 'Di ba yung mga nakakaamoy ng kandila, ng mga bulaklak o rosas, but this is a benign hallucination. Okay. The hallucination is in schizophrenia is more severe because it doesn't go away and it is continuous from the moment you wake up until you sleep. Okay? Now, there is also disorganized thinking and disorganized speech. What do we mean by disorganized? Ito na ho yung hindi na naintindihan ng tao kung ano iniisip niya, such that what they say will all be jumbled or what they say will not be understood by the people around them. Kaya we call it disorganized speech. And this will also equate to extremely disorganized or abnormal motor behavior. We usually see this disorganized behavior in people with mental disorders who are roaming in the streets, or yung extreme po na case na ganito is yung mga taong grasa. Kikita po natin sila parang isang taon na pong hindi naliligo, ganun, etc. Other examples of disorganized behavior are childlike silliness or unpredictable agitation, difficulty in doing tasks, resistance to instructions, inappropriate or bizarre posture or inappropriate behavior. Yan. In a complete lack of, di ko po makita yung slide ko. Maybe it's a complete lack of restlessness yata. Anyway, so yung complete lack of response or useless and excessive movement. Yon. So these symptoms are seen in schizophrenia. But these symptoms can also happen in a person with Down's syndrome. Okay. Now, there are more symptoms of schizophrenia. This group of symptoms naman, we call them negative symptoms. The previous symptoms I described, we call them positive symptoms. Let me define pala muna what positive and negative symptoms mean. Positive symptom is one symptom which is actually supposed to not be there but happens. Example, yung hallucination, dapat wala tayo nun, but it's present. So that's a positive symptom. Yung negative symptom naman po, dapat nandoon yun sa tao, but biglang nawawala. Okay? Ano po ba mga to? Example are reduced or lack of ability to function normally because we are expected to function normally, di po ba? Okay. A person may neglect his personal hygiene. Di ba? We are expected to take care of our hygiene. We're expected to shower every day, to brush our teeth. But sa taong may schizophrenia, nawawala po ito. Okay? The person may also seem to lack emotion. So para silang they do not react or they do not cry pag malungkot, they don't laugh. Parang nawawala rin yung expression sa mukha. Okay? They may also lose interest in everyday activities or withdraw from society. Okay? And they lack the ability to experience pleasure in their activities. Okay? Now, other possible symptoms are difficulty sleeping or maintaining sleep. Yung iba ho, 1 oras na lang ang tulog, 2 oras na lang. Other symptoms is irritability or galit na wala naman siyang kaaway but galit pa rin yung tao. Or the person might be very anxious because of his hallucinations. Okay. Now, all of these symptoms of schizophrenia I mentioned can be present in Down's syndrome, but I prefer not to call it schizophrenia because we have another term or diagnostic term. We call it psychosis secondary to a medical condition. The medical condition which is trisomy 21 or Down syndrome. Kasi the schizophrenia happened to a person with Down syndrome. Pag nangyari po yung symptoms na yan to a normal person without Down syndrome, it's called schizophrenia. Okay po. Now, as I have mentioned na when the person with Down syndrome approaches the later years, they can develop Alzheimer's, and these are the possible symptoms: apathy, irritability, destructiveness or aggression, silliness, restlessness, incontinence, madami po. So all of this may signal that the person has Alzheimer's disease. Okay, now I want all of you to have an understanding why all the problems that I have talked about happens to a person with Down syndrome. First of all, the primary pathology is triplicate of chromosome 21, right? When this is present in a person, it has an effect on the brain or in the brain. Okay, this is a picture of a brain of a person. Side view po. The eyes are here, the ears are here, and this is the back of the head. The different colors will delineate different parts of the brain with different functions. So this is the frontal lobe. This is the cerebellum. This is the pons, or I think this is the pons or cerebellum. I forgot. But this is the midbrain in the middle. Ayan. This is the this part is in charge with movement and sensation of our skin. Okay, so I just want you to remember that the brain has various functions. So iba-ibang parts po ng brain, iba-iba po ang ginagawa. But the brain as an organ is the main command of our body. Okay, for my patients, I usually explain it as para pong computer ng katawan. Okay, di po ba ang kotse may computer? Pag nasira po yun, hindi aandar ang kotse. The brain acts the same way. It commands your whole body, the body organs, your movement, your sensations. And let's not forget, the brain is also in charge of your thoughts, your hearing, and your senses, and your speech. It's also in charge of your work. That's why you're able to work every day. You're able to raise your families. You're able to listen to me right now because of your brain. Okay. Now, these again are the different parts of the brain. Ayun. This is the occipital lobe, this is the cerebellum, and temporal lobe, frontal lobe, parietal lobe. Yan po yung mga pangalan nila. The spinal cord runs behind your back. Okay po. Now, how can the brain do such a complex task, controlling everything in the body? Okay. The brain's composition is more than 100 billion cells. The cell, we call it a neuron. Okay? And this is a simple picture of one neuron. Kaya po may mga sanga-sanga siya kasi each neuron is connected to other neurons. Okay? Remember po what I said earlier, the condition of having 3 chromosome 21s has an effect on the brain. That's why the child born with Down syndrome will have or will manifest certain symptoms, like for example, intellectual disability, uh, delayed development, because the brain, that's what the brain is dictating the body, the physical body. Okay. Now, again, this is a simple picture of one neuron and its connection. The connection is what we call the synapse. Okay? But this neuron is connected with other neurons pa. So, para siyang spider web na konektado sila lahat. But I want you to concentrate on this one, the synapse, because that is the source of the psychiatric problems. Okay. Let's look at this. Don't mind the words. Just look at this one and this one. Okay, this is the synapse which is enlarged. Ito po yun. Di ba maliit na maliit? When we enlarge the synapse, this is how it looks like. So this is one neuron, this is another neuron. The way the brain works is that the brain sends signals to your whole body for it to keep working. Di po ba yung ating heart tuloy-tuloy na tumitibok forever? Kahit ayaw natin, or yung mga gusto pong mga kabataan na sasabihin, I don't want to live anymore, I'm stopping my breathing. Hindi po nila magagawa yon kasi yung brain, uutusan pa rin sila na mag-breathe or magtibok yung heart. Even if you tell your body not to beat yung heart mo, tuloy-tuloy pa rin. Why? Because the brain continuously sends signals to your heart to keep beating. Okay. Now, going back to this, the signal which I'm talking about is called an action potential, and it is passed from one neuron to the other neuron. Okay. Now, the neuron uses neurotransmitters. These are the round figures to transmit the action potentials. Okay? Now, when a person is stressed or has a condition affecting the brain, like Down syndrome, other conditions affecting the brain are stroke. You've heard of stroke. Seizure disorder or convulsions, di po ba? They all affect the brain. Even cancer, di po ba? This will all affect the neurotransmitters in the synapse. So when that happens, a host of psychiatric problems will happen. Okay, ano po ba yung mga psychiatric problems like the ones I discussed earlier? Okay, so this event actually cannot be seen by normal laboratory tests. For example, magtataka ka kung may panic attack ka, those of you who have experienced a panic attack, it's very severe and it feels like you are going to die of a heart attack. So because of this fear, you run to the emergency room. The doctor at the emergency room will order several laboratory tests. You will spend thousands of pesos. Baka isama doon ang CT scan or MRI. This will turn out normal. Why? Because the source of the panic attack is very small. It's in the synapse. Dito po. Hindi na po yan nakikita ng CT scan or MRI because the CT scan or MRI is just a slice of the brain and does not look inside the cell or the synapse. Okay po. Now, I'd like to define what a mental disorder is. It is a syndrome characterized by clinically significant disturbance in an individual's cognition, emotional regulation, or behavior that reflects a dysfunction in the psychological, biological, or developmental process underlying mental functioning. So kasama po dyan ang emotions or mood problems. Mental disorders are usually associated with significant distress or disability in social, occupational, or other important activities. So when a person develops a mental disorder, ang kanyang work is affected and relationships with families and co-workers are affected. When the person is a child, the school is affected. Okay. Now, uh, as a child psychiatrist, a lot of people who haven't talked to us or who haven't consulted us might feel apprehensive or anxious about consulting us kasi we all recognize that there is still stigma with regards to mental health. Usual anxiety po ng tao is, naku, baka sabihin ni doktora may mental problem ako or may psychosis ako. That's really understandable. But the child psychiatrist is a physician who is specially trained in managing a child's behavior and overall mental health. The child psychiatrist may make recommendations about therapy, behavior modification, school recommendations, medications which might be helpful, and family education. Pero I'm sure all of your kids have a developmental pediatrician. The developmental pediatrician may also assume the role of the case manager. Okay po. Now, the psychiatrist may plan and implement a cognitive behavior modification program, do parent counseling as well as family therapy, establish close collaboration with the school staff and his parents, manage the use of medication because that involves special training. Okay. Now, I'm sure you are all wondering what are psychoactive medications, and this is our specialty talaga. And I also know that many people will be scared when they hear psychoactive medications. So I'm going to explain to you what psychoactive medications are. These are medicines or drugs that exert significant effects on the mental functioning or behavior by altering the chemical makeup of the central nervous system. Okay. These drugs do not cure Down syndrome. They only treat the problem behaviors. Okay, let's go back to the synapse. Di ba synapse? Ito sabi ko. Ito po ulit. Yung connection ng dalawang neuron. And this synapse is the location of the neurotransmitters. Ito po yon. The neurotransmitter is a chemical which is affected by many things like stress, your genes, your medical condition, uh, your your work, your social relations, they all affect the neurotransmitters. What happens when they are affected? Some neurotransmitters decrease, some increase. So when this happens, you will experience the different psychiatric problems I mentioned earlier. And the problem is when it becomes an illness, it doesn't go away even if you don't want them anymore. So, nandyan talaga. Kahit ayaw mo na marinig yung hallucinations, nandyan. Okay po. Now, psychoactive medications will correct, psychoactive medications will correct these neurotransmitters. They will put the neurotransmitters back to their normal levels. That is why the psychiatric problems will diminish. Mawawala po yung mga hallucinations, yung aggression, yung marami pong kabataan na may major developmental delay ang nagiging aggressive or sinasaktan yung sarili. Marami na po akong nakita, sugat-sugat na, or yung mga caregivers, bugbog sarado na, pagod na pagod na. But if the neurotransmitters are corrected, these behaviors can disappear. Okay? Pero hindi ho madi-disappear yung primary condition. It's just the behavior. Okay po. So most parents have several concerns about psychoactive medications, lalo na po pag first time namin sinasuggest it or nire-recommend ito. So what are the common concerns of parents about putting their kids on psychoactive medications? I will answer these questions. All medications have at least some serious risks, and parents worry about putting their child at an additional risk. It's true, psychoactive medications have side effects, but we emphasize all medicines have side effects. And it is us, the psychiatrist, who know what side effects are present in a certain medicine. And we usually prescribe the medicine with the least side effects, which is fitted to the individual patient. For example po, yung patient mo is sobrang malaki na, mataba, obese. Of course, we will not prescribe you with a certain medicine na nakakataba, like example, olanzapine, kasi lalaki lalo. We will prescribe you with a different medicine kasi less ang nakakataba. Or if the child naman is extremely thin, hindi na kumakain, then we can give the olanzapine para mag-improve yung appetite and mag-gain ng weight. So what I mean to say is we tailor the medicine to the individual child. Okay? If a teacher naman suggests the possibility of a prescription medicine, most parents will interpret it as the teacher is giving up on the child. Actually, understandable po yun, but in reality po, hindi naman po ganun ang case. It can be that the behavior is not disappearing, although the school has exhausted all means to solve it. Hindi talaga nawawala because the problem is already, I have discussed earlier, in the synapse and in the neurotransmitters. Okay. Another big fear of parents is that their child may act like a zombie or parang naninigas or nadodoped or nasa-space out. Actually, we also know which medicines causes this. Ito po yung mga lumang-lumang mga medicine noong ginagamit po noong 1970s, 1960s. Talagang marami kasing side effects pa noon. But right now, because of technology, there are so many newer medications and that side effect is almost gone in the new medications. So, marami pong tao na may schizophrenia ang makakasalubong nyo sa kalsada na hindi nyo alam na meron kasi wala na po yung nazo-zombie na side effect. And another concern is madedependent ba? Ayokong madependent or ayokong mag-rely sa meds. Actually, it is us who know which medicine will cause an addiction and which will not. And we have strict protocols for the patient not to develop addiction. Okay. So when or what are the criteria for using psychoactive medications? We ask these questions before we decide to use psychoactive medications. Is there any behavior that is such a problem that the child is frequently injuring himself or others? Kung nananakit na po ng ibang tao or sinasaktan na yung sarili, well, psychoactive medication is strongly recommended. Have behavior approaches been tried with little or marginal success? Are the problem behaviors present in more than one setting? Tipong hindi nyo na po kayang dalhin sa social gatherings yung anak nyo, kinukulong na lang sa kwarto kasi yung problem behavior nakakatakot, well, medicines will really help. Or do the behaviors to be treated interfere with the child's ability to learn? Well, these have different angles or answers depending on the medicine. Are the potential benefits of the drug likely to compare favorably with possible short and long-term effects? Okay. So, what are the common psychoactive medications used for children. These are antidepressants, or what we call specific serotonin reuptake inhibitors for anxiety, depression, and OCD. Antidepressant is just a common term, but it is also used for anxiety. Kasi sasabihin po ng patient naman may anxiety, Doktora, hindi naman po ako depressed, ba't mo ako bibigyan ng antidepressant? So I always explain, this medicine is not just for depression, it's also the drug of choice for anxiety. Benzodiazepines naman are very helpful for agitation and anxiety, but the effect is very limited, just a few hours. Okay. Mood stabilizers are very helpful for aggressive behavior or violence and mood swings. Antipsychotics naman, I prefer to call them serotonin dopamine antagonists because they are useful not only for psychotic symptoms, they are also helpful for aggression, violence, and mood swings, and even for sleep. Okay? The stimulants naman help in the symptoms of attention deficit hyperactivity disorder. They will uh, fix the poor focus and the attention span. Okay, so when do you refer to a child psychiatrist? Okay, well, any change in the following: behavior, mood, sleep, academic performance, relationships to family, peers, or classmates, which are disturbing and is not going away, then it is high time to refer to a child psychiatrist. Okay? Now, how do you contact a psychiatrist? Before COVID came, all of us were doing face-to-face consults. So you had to go to our clinics to get a consult. And for the information of the audience, there are only around 600 psychiatrists in the whole Philippines, which is about 111 million Filipinos. Now, the child and adolescent psychiatrists, who are members of the Philippine Society for Child and Adolescent Psychiatrists, we are only 63 in the Philippines, whole Philippines, to help the 111 million Filipinos. And for the information of everybody, our country is a young country, and more than 50%, 52% to be exact, belong to the age of 24 years old and below. So kabataan marami. But luckily, when COVID came, all of us went online. So nagagawa na ho natin yung online na ganito. And I saw in the audience, meron nga pong mga from other countries, may mga from KSA, may from Cagayan, di ba? So we can reach a wider audience online. So, for the people who are farther from Metro Manila, this is the website. This is the website of the Philippine Psychiatric Association. This one, our directory is there for you to find out who is the nearest psychiatrist in your area. Actually, yung adult psychiatrist, may rotation naman yan sila sa child na 3 months. So kung wala hong child psychiatrist sa area nyo, you can approach your adult psychiatrist. Or if your child is 18 and above, pwede na yan sa adult. Now, yung Philippine Society for Child and Adolescent Psychiatrists, we also have a directory online. We have a Facebook page. I just wasn't able to write it in my slides, but we have a Facebook page. Okay, our directory is also there. Okay. Now, but as parents, in the meantime, what can you do? I'm sure your pediatrician has recommended all of this, but I will just like to reiterate the following to help your family and children. First of all, take care of yourself. Build a support system like the DSAPI. This is a very good support system. Okay. And I can see that the organization is already well in place. You're very organized. You have very responsible officers. Okay. Talk about your challenges. Keep a list of things that you need to do. Find time for friends or socialize. Go easy on yourself. Make relaxation activities a part of your daily schedule. Because if it's not written in your schedule, I am sure it will not happen. Ngayon nga akong nagka-COVID, sinali ko na rin po sa aking schedule ang mag-exercise. Dapat may exercise ako ng 1 hour and 15 minutes. Nung hindi ko pa po sinusulat yun sa aking schedule, hindi nangyayari talaga. Okay? And most of all, take care of your health because your family needs you. Okay? For the child naman, what are the tips? Give your child household chores. I always recommend this to parents because did you know that a lot of parents do not teach their children household chores? These are actually life skills which your children will need once they are out of your houses now, once they're adults. Okay. Let your child play with others, whether the playmates have or don't have Down syndrome. Keep your expectations high but reasonable. Make time to play, read, have fun. Support your child in doing his tasks. Create a daily routine. Actually, children will thrive in routines. Okay? Thank you for your kind attention. That is all.
Thank you very much, Dr. Vanessa. Napakarami palang bagay na dapat kaming malaman no, as parents of persons with Down syndrome. No? At marami pong salamat. No? You have provided us parents with additional knowledge and information for the benefit of our children. Siguro, after this lecture, Kapihan, we will be better prepared no? to follow, particularly mga tips na sinabi ninyo, no? To safeguard the mental health of our children. No? Particularly, dapat pala, kahit kami mga parents, must first take care of ourselves before we can take care of our children. No? So thank you. Maraming salamat, Dr. Vanessa. But please stay because we are now going to open the portion on open forum. But bago po tayo patuloy, ay mga ilang paalala kung anong dapat nating gawin. No? Pwede niyong isulat yung mga comments niyo or questions doon sa comments section. No? I noticed that marami na rin naman gumawa niyan, nagko-comment at may mga question. At some point, pwede ko rin tawagin yung panel natin, yung mga 3 panel members para magbigay din ng kanilang komentaryo at kuro-kuro. No? At as your moderator and host, tatawagin ko po kung sino sa kanila ang bibigyan ng pagkakataong magsalita no? Para lang maayos yung traffic natin sa question and answer. So, okay ba tayo? So, kung okay, pakisulat okay sa comment section. No? So, let me start the first question and I'd like to address this to the panel members. No? Siguro, I'd like some short answers to this question lang. What interested you most about what Dr. Vanessa said in her lecture? And why? No? Ano yung pinaka-idea na naging interesado kayo talaga doon sa narinig nyo kay Dr. Vanessa at bakit? So maybe I'd like to call on panel member Ed Sanchez first.
Hi. Unang-una, gusto kong bumati sa lahat ng viewers natin from all over. May Finland pa ako nakita, from the Middle East, tsaka all over, Visayas, Mindanao, Luzon. Ano? Magandang hapon sa inyong lahat. I'd like to share lang kasi I could easily relate to the discussion of Doktora. Our case came that my daughter's Micaela, Doktora, high functioning until the age of around 25. Bimedaled siya eh. Mas marami siyang medalya sa kahit sino sa pamilya namin. She memorized the Bible and all. But one day it came as a perfect storm. She was diagnosed with hypothyroidism and nagkaroon siya ng severe depression. severe lack of appetite, tapos white perfect storm. Kasi at the same time, we had a house help who has been with us since yung birth niya that had to get married. So, umalis na. So, talagang na-down ang husto si Micaela during that time. And I would say, unfortunately, uh, ano siya, nabigyan siya doktora ng ng antidepressant, escitalopram, wherein she had an adverse event, adverse or side effect, na talagang muscle spasms, drooling and all, tapos nagkaroon siya ng hallucinations, my concern there is still to guide our parents. How do we now differentiate one from the other? Yung siyempre, the intervention would depend really on proper diagnosis, doktora, di ba? So to guide our parents, when do you see if this is a behavioral matter? Is this a psychiatric issue? Neurologic? Is this a physical thing that we have to isolate? What are the lookouts, doktora, and what are the steps?
Okay po. Okay po. Thank you po for that sharing, Sir Ed. Unang-una po, I'd like to say na ang mental health po ng tao, many factors affect our mental health. We usually have a tagline for this, biopsychosocial. Ibig sabihin po, biological factors, psychological factors, and social factors all affect our mental health. Idagdag na rin po natin ang spiritual. So it's now biopsychosocial-spiritual factors ang nag-a-affect ng ating mental health. So sa child niyo po, una pong napansin, nagka-thyroid problem. Ang thyroid po kasi also has symptoms which are seemingly psychiatric-like. Parang psychiatric problem, but actually ang source ay thyroid problem. So pag ganito po ang nangyayari, dalawang specialist dapat ang nagmamanage. May psychiatrist ka and may endocrinologist to treat the thyroid problem. And nadagdagan pa po yung pag-alis po ng trusted yaya. That's another big factor. Di ba sabi ko kanina, children or even us, older people, really thrive on routine. And pagka naalis po yun, biglang umalis yung yaya kasi she got married, it will have a big effect on the child. Now, regarding to the medicine, sabi niyo po nagkaroon ng side effect, but I don't know kasi hindi po ako yung doctor ng anak niyo, no? But the side effects you mentioned are usually not found in the medicine you mentioned, the escitalopram. So I'm thinking the doctor also gave other medicines kasi po yung drooling, yung hallucinations are not part of the side effects of escitalopram. Maybe they are part of the problem pa rin, or maybe the doctor gave you other medicines. Tama po ba ako, sir?
Yeah. Actually, yung kaya namin na-isolate doon sa kanya, doktora, kasi yun lang yung tinitake niya. In fact, yung escitalopram was sort of parang a wonder pill initially. Naging upbeat and all. Kaya lang yung medication was extended for, I think, 3 months. And little by little, parang we notice yung changes na ganyan. Tapos hanggang at the end of it all kasi naitakbo siya sa ER, doktora yung sinasabi kong muscle spasms and all. And she was just taking that. So we had to win her out of that. Kaya lang parang from a Disney kid, alam mo yung ganon, all positive, nagkaroon siya ng parang traumatic, memory na in fact up to now every now and then, parang lumalabas siyang gano'n na once upon a time, wala naman siya.
Yes po. Actually, sir, yun po. Yung escitalopram is an antidepressant. It does not do anything to hallucinations. Hindi siya magpo-produce, hindi rin niya ititrip. Kaya palagay ko yung hallucination was there kasi it doesn't treat the hallucination. Yun po yun. So, ang pinakamagandang step po is ibalik niyo po siya sa psychiatrist niyo, explain all of this so that the psychiatrist can manage the problem
Yeah.
or can give something else kung hindi nag-work yon or give medicine from another family.
Yes.
Ganun po.
Last to that situation, actually she's being managed by a psych naman. Because that was doktora, close to 5 years na yun nangyari. Kaya lang ang I hope yung during that time I was able to ask the doctor ano ba yung mga lookouts kasi ang difficulty doktora yung mga anak natin na may Down syndrome, di ba? Hindi sila naman nakakapag-express, di ba?
Yes po.
Hindi nila alam kung ano yung so it will everything will be just based on observation.
Yes
Ayan.
po. Ang red flag po talaga if pag may sudden change sa usual niya na ugali. Pag may sudden change or pag may danger, like ano pong danger, sasaktan yung sarili, nagkakat or nagbabasag or tantrums na hindi tumitigil, yon or nakakaistorbo na sa mga tao. Yun po.
Yeah. And Dr. hindi ba yung mga medicines na ito, mga CNS, Central Nervous Acting System Acting Doctors, meron din siyang, you don't take it away abruptly, di ba? Cold turkey.
Actually, sir, ayan, usual tanong po yan. Actually, sir, pag hindi addicting ang medicine, pwede mong gawin yon if you want. If the person wants. Wala naman mangyayaring kakaiba sa'yo. It's just that babalik ka lang sa dati mong symptoms. Yun po. But the reason na tinitaper namin or hindi namin tinitigil bigla-bigla, tapering is lowering the dose over a period of time is because ako po I do that because I want to observe the person kung babalik yung symptoms if hahatiin natin yung dose. Kasi pag bumalik po yung symptoms, ibig sabihin, nandyan pa yung problem. So we better not lower it. Yan po.
How about withdrawal symptoms? Meron ba siya?
Okay. Yung withdrawal symptoms po, part po yan ng addictive substance. Ang addictive substance po, may dalawa po siyang characteristic. Tolerance and withdrawal. Yung tolerance po, hindi na tumatalab sa kanya yung dating dose. Yung withdrawal is pag tinigil mo bigla, meron kang mga bago na symptoms or kakaiba na napaka-uncomfortable talaga na madadala ka sa ospital.
Thank you, Doktora, for that enlightenment.
Okay.
Thank you.
Salamat. May I hear from Malu Ortiz, our panel member.
Hi. Good afternoon. Good afternoon, Cesar and Dr. Vanessa, and to all our viewers here at DSAPI. I'm very thankful to you, Doc, na ang daming information na first time sa akin, lalo na yung mga psychiatric problems such as mga nabanggit mo yung mga schizophrenia. I know the term, but it's very new to me na related pala siya sa Down syndrome. No? My daughter, Clarissa, born with Down syndrome, she's now 35 years old. At the age of 18, when she was 18, she started showing, active siya ng bata, but she started showing mga tantrums, no? Akala namin tantrums lang, no? So we started disciplining the child. In fact, nakatingin siya ng palo, no? Pero we realized hindi nag-e-effect yung palo. In fact, parang pag the more mo siyang paluin, the more siyang nagagalit, yung nanlilisik yung mata niya, and she'll hurt us back, no? And from that time on, nagtuloy-tuloy yun yung violence. Kinukurot niya ako, pasa-pasa ako, hinahatak niya yung hair ko, naglulupasay siya. So I started consulting also a psychiatrist, and she was diagnosed as having bipolar. And then was given Depakin. My question is, our situation kasi is I'm separated from my husband and she's very attached to both of us. She sleeps with us. Eh. Could it be also that, and she's also hearing impaired, hearing and speech impaired. Could it be that yung kanyang mga behavior na ngayon is due because of frustration, not being able to hear, not able to express how hindi siya nakaka-understand? And then second, is it also, can it also affect her that um, she jumps from one house to another because there are times 1 week siya sa daddy niya, 1 week siya sa akin. So yung palipat, siya yung pinaka-affected sa lahat dahil siya yung lipat-lipat ng bahay. No? So there's yung changes na nangyayari sa bahay. So is it really bipolar? I have this question, was she really diagnosed by, tama kaya yun or is maybe their circumstances?
Okay. Ma'am, kagaya po ng sabi ko kanina, ang mental health ng tao ay affected ng biological, psychological, social, and spiritual factors. Sama-sama po yan will affect the mental health of a person. Yung sinasabi niyo rin na her symptoms were not disappearing even with this discipline, even with behavioral modification, hindi na po nawawala, di ba? To the point na nagkaka-violence na, ng sinasabunutan kayo, kinukurot, pasapasa na kayo. That's what one of the red flags na kailangan na talaga ng professional help. Now, yung mga social factors naman, like yung nag-shuttle siya between you and the husband, those are part of the factors which can affect or which can exacerbate this problem. Pero hindi naman po yun lang ang cause. Kasi marami pong sources yung behavior niya eh. Nandoon na yung may Down syndrome siya. Nandoon na yung may bipolar siya. Palagay po yung situation na yun was only intensifying the symptoms. Okay po. Now, yung question nyo naman about the hearing impairment, tama po kayo, ma'am. Kasi when a person or a child cannot hear and cannot speak, they will communicate by behaviors. Anong behavior usually? Tantrums, violence, aggression, because they cannot speak. They cannot say that they are not feeling comfortable. So what will they do? They will throw a tantrum, they will hurt others. Yan po.
Thank you so
Okay.
much. No, thank you so much.
Thank you. Iwanan ko sandali yung panel at ako'y mag-shift sa isang live question. No, ito babasahin ko. Good afternoon po. My son is turning 3 years old this coming March. Madalas po inuuntog niya ang ulo niya to the point na nakakabukol-bukol na siya sa ulo. He is diagnosed with hyperthyroidism and taking medication for CHD-AVSD. My question is how to deal po with this behavior of my son. Thank you.
Okay po. Ang suggestion ko po dyan, ma'am, consult talaga a child psychiatrist para matulungan kayo. Because ang approach po dyan is also not simple kasi as you have mentioned, una po, the child has a thyroid problem. Di po ba? Tapos may chronic heart disease ba yun? CHD? Yun. Marami pong physical na pinanggagalingan. So, ang pagbigay nga po ng medicine for that will also be complicated because we will have to avoid medicines which will affect the child's physical condition. Okay. So, consult po kayo ng child psychiatrist.
Okay, salamat po. Meron pa ba tayong live question, Edel? Yan. Magandang hapon po. May katarungan po ako tungkol sa aking anak. 10 years old na po siya. Dito man nakalipas na buwan po kasi panay ang pagsuka niya. Nung una, akala ko baka may something wrong sa tummy niya. Kaya pinatignan ko po siya sa pediatrician at binigyan naman siya ng gamot para sa acid. Dahil baka daw po may acid reflux na. Pero napansin ko po na okay naman po siya buong araw. Hanggat hindi ko sinasabi na maliligo na siya, doon po siya nag-start sumuka. Parang ayun po yung way niya para whatever, hindi. Yes, Dr. Vanessa, ano pong
Okay
masasabi?
po. Actually po, kung na-clear na po siya ng pediatrician, ibig sabihin wala naman nakita yung pediatrician, magwa-wonder ka ngayon bakit siya nagsusuka. Ang isang possible po na pinanggagalingan niyan is possible lang po I'm not saying it's the only one, pero very possible na may anxiety. Okay po. Maaari nating isipin nag-iinarte pa ito na nagsusuka-suka, but ang anxiety po is talagang napaka-uncomfortable feeling niyan to the point nga na nagsusuka yung bata. Lalo na 'pag nandiyan na yung trigger, yung kinakatakutan niya. In fact po marami po tayong naririnig na napapaihi sa damit, napapapupo sa damit, lalo na po yung mga sobrang takot na takot, yung mga tino-torture. That's because their anxiety level is extremely high na naglo-lose sila ng control ng body functions nila. Like nasusuka sila or nawiwiwi or etc. Yun lang po yun.
Salamat po.
Ay, meron pa po akong
Aya.
idadagdag, sir. Yung acid reflux pala is exacerbated din yun by anxiety. Yun lang po.
Yun. So sige, meron pa tayong ibang live question. Ito. Teka muna. Unahin ko itong isa. Good afternoon po. Yung anak ko po may sleeping problem. Long hours po siya matulog. But nag-out of town po, sa haba ng trip, doon po siya natutulog. And it causes her tantrums. Any help po?
Yan po yung isa sa examples na sinasabi ko na pag nagkakaroon ng pagbabago sa routine, medyo nakaka-affect din yun sa behavior ng bata kasi nag-out of town trip po, baka hindi po siya sanay sa out of town trip. Pero i-observe niyo po kung mawawala yung tantrums pag bumalik na kayo sa bahay. Kung hindi naman po, ilang buwan na, ilang linggo na, hindi pa rin nawawala yung not sleeping or tantrums, maaaring kailangan na kayong mag-consult ng doktor kasi medyo matagal na hindi nawawala. Kasi kung dahil lang po yon sa nag-out of town trip kayo, usually pag bumalik kayo sa bahay, bumalik yung dating routine, mawawala naman po yon.
So yung isang tanong simpleng tanong. Good PM. Pwede po ba, doktora, na online consultation sa inyo?
Sir, 99% po ng patients ko online.
Okay.
Oo.
Thank you. So isa naman, si Yolanda Gomez. Doktora, my daughter is 40 years old. She has this habit of talking to herself. After the pandemic, it has become more intense. She has a number of imaginary friends and you can hear her talking to them most of the time. Is this normal?
Okay po, maganda po yung tanong na yan, ma'am. Actually po, what you are observing are the signs of auditory hallucination na sinasabi ko kanina. Yung auditory po is A-U-D-I-T-O-R-Y, auditory for ears. She is hearing her imaginary friends talking to her. That's why she is replying. But you as the family member does not hear the hallucination. Kasi hindi po kayo nakakarinig doon. Siya lang. Kasi galing yun sa brain niya. And since it's very real for her, she's really hearing it, kakausapin po niya talaga. To the point na she will not pay any attention to the people around her. Ang kakausapin na lang niya, yun hong mga imaginary friends niya. Actually, they are very real for her. Yun po. To,
Okay.
to treat that, kailangan niyo po ng consult ng psychiatrist.
Okay, thank you, Doctor. From Lema Corpus. Good afternoon po. Tanong ko lang, yung anak ko po ay may DS. Bakit po kaya matulog siya gabi ay sobrang likot at hindi siya mapakali? Bakit po kaya? 7 years old na po siya. Salamat po.
Marami pong causes po 'yan. Siguro hindi po natin masasabi. Pwede pong ordinary restless leg syndrome lang or merong organic cause. Ang pinakamaganda po is check muna with your pediatrician or child neurologist.
Okay. Sige, thank you. So, babalikan ko lang po ang panel member natin, si President Luis Arder naman. Ano? President Luis, ano ba ang challenges na na-encounter nyo kay Adeline?
Good afternoon ulit sa inyo, no? Actually, ang naging concern lang, siguro ayaw namin i-confront yung parang mental health yung involved, no? Yung word, parang psychological yan, o psychotic yan, o psychiatric yan. Parang may stigma nga, sabi nga niya, no? So, siguro hindi rin nakatulong sa amin yan, ano? Hindi rin nakatulong sa amin yan kasi parang pinatagal mo muna bago ka mag-seek ng medical help, no? Pero salamat kay doktora at naipaliwanag sa amin yan sa amin na hindi niyo dapat yan katakutan. So hindi niyo dapat yan iniiwasan. So yan lang din siguro yung advice natin sa mga parents. If you see the symptoms that we discussed with doktora, please see a child psychiatrist immediately. Ngayon, ang question ko kay doktora, kasi nung nagkaroon na ng regression si Adeline, so we consulted first with her developmental pediatrician, no? Developmental pediatrician. Siya yung kinonsult namin. And then napansin niya nga na kasi since baby pa lang si Adeline, isa yung developmental pediatrician niya and regular talaga yung check-up niya. So nakita niya yung progress ni Adeline, nakita din niya yung regression ni Adeline, So sabi niya, it's about time for you to see, tatlo yung binanggit psychologist, psychiatrist, and neurologist. So, doktora, for the benefit of our viewers, ano ba po talaga yung dapat na mauna after the developmental pediatrician? Who should the parents see?
Okay. Actually po, sir, kasi ang Down syndrome is a developmental delay, di ba? Ang symptoms niya. So, unang-una talaga dapat developmental pediatrician pag baby pa. Pero, mas maganda kung psychologically minded ang inyong developmental pediatrician na pag may nasisense siya na psychiatric or psychological problem, he or she will refer to the appropriate mental health professional. Now, I'm sure marami magtatanong, ano ba yung kaibahan ng psychologist sa psychiatrist? Usual tanong po yan sa amin. Yung psychology, marami din po silang specialization. May mga psychologists po who specialize in human resources or HR. May mga psychologists who specialize in giving psychological testing. Ito po yung mga psychometrician. Meron din hong mga clinical psychologists who specializes in therapy. Pero yung kaibahan po ng psychiatrist is the psychiatrist is a medical doctor who specializes in psychiatry. Okay, so we specialize in diagnosing and treating people who have mental health illnesses na. Okay, so yung may illness na talaga ang specialty namin in treating these mental health illnesses. Yun po.
Ma'am, yung doktora yung pong neurologist. Why
Neurologist. Okay po. Very important din po, nakalimutan ko, sorry po. Very important din po yung child neurologist or neurologist. Kasi, as I have said, yung Down syndrome or trisomy 21 has an effect on the brain, di po ba? So, ang neurologist po, ang gumagamot naman, pareho pong brain ang ginagamot ng psychiatry and neurology. Pero yung neurology po, more on the structure of the brain. For example po, yung stroke, sila po gumagamot niyan. Brain tumor, sila po gumagamot niyan. Yung sa psychiatry po, ang ginagamot namin, yung mga problems doon sa synapse na nagkukos ng behavior problem, thought problem, mood problem. Pero kung lesions sa brain, like tumor, cancer, seizure disorder, or stroke, mga ganon, neurologist po yun. Actually, we work as a team. Kung mauna man po kayo mag-consult ng neurologist, sasabihin nila, dapat po sa psychiatrist na kayo pumunta. Ako rin po, pag pumunta kayo sa akin una, doesn't matter kung sino ang una. Kasi pag na-sense ko po na dapat neurologist ang gagamot dito, I'll really refer you to a neurologist. Ganun ho kami talaga.
Okay. Doktor, one more thing po, no? Yung kasing nag-start yung case ni Adeline Joyce, parang we were referred na nga dun sa neurologist kasi they want gustong parang ma-isolate o ma-confirm kung merong, you call this NMDA receptor encephalitis po, no?
Okay.
Nagkakos po ba yan ng ano? Ano po ba yung effect niyang NMDA receptor encephalitis sa mental health ng isang batang may Down syndrome?
Actually po, yung ginagawa ng neurologist nyo is nirule out niya kung may neurological or physical problem na nagpo-cause ng behavior ni Adeline. Ang isa nga hong possible ay NMDA encephalitis. Kasi yung symptoms po nun is similar. Halos pareho. Pero may makikita siya na infection, encephalitis. Makikita po yon sa mga CT scan, EEG. Kaya po siguro marami siyang laboratory na ginawa. Pero negative po lahat yon. Kaya talagang nag-decide siya na i-refer sa child psychiatry. Kaya talagang team po kami. Ganun po yun.
Thank you, Doktora. Audience, mahalaga yung sinabi ni Doktora na yun. Please take note of that. Thank you, Doktora.
Thank you, Doktora. Thank you, Luis. Balikan ko lang si panel member Malu Ortiz. May question?
Yeah, Doctor, question kasi nga common nga sa ating mga adult people with Down syndrome, yung sleeping disorder, no? Yung daughter ko kaya niyang hindi matulog ng more than 24 hours. Is it all right if I give her melatonin?
Ay, melatonin is very okay lang po. Kung tumatalab po, okay lang po yun.
Okay, thank you.
Okay. So nabanggit yung pagtulog. Si Ida Mercolita ay may tanong. My son Rafael John, 26 years old, lately po, buong gabi po siyang gising. Pagdating ng 5 a.m., doon na po siya natutulog. Hanggang 5 p.m. naman ng hapon. Ano po ang iyong comments?
Bago ko po sagutin yun, I'd like to add something to Ma'am Ortiz question. Yung melatonin po acts like a psychoactive drug. Doon din po yan nag-work sa neurotransmitters. Kasi melatonin is a natural substance or chemical sa brain natin which helps with sleep. Similar po to psychoactive drugs. Similar po. Tapos yung question naman ni Ma'am Ida na buong gabi gising yung anak niya, well, palagay ko ma'am, dapat na po yan i-consult kasi hindi po talaga healthy na babaliktarin mo yung tulog mo. Like, gising ka buong gabi and tulog ka sa umaga. Hindi po yan healthy. I'm sure meron pa pong mga other problems yung anak niyo na si Rafael John.
Thank you. So, more live questions? Meron ba tayo dyan? From Cathy. Or, hello, should I consult a child psychiatrist even if hindi naman nabanggit ng developmental pedia? Though I informed the DevPeb about my concerns, binubugbog ako. Kapatid niya, very unpredictable behavior, could be violent and hyperactive. I didn't quite get the answers aside from her diagnosis of moderate to severe global delayed development. She's 11, has hypothyroidism and AVSD post-surgery.
For Ma'am Katie, dapat na talaga po siyang mag-consult ng child psychiatrist. Bakit po? May aggression na po and bugbog sarado na po ang mga family members. Even if the DevPIDs did not say it, well, you really need help kasi kawawa po naman ang family and yung anak nyo. Okay po. Actually,
Ayun.
pwede rin ho kasi baka ho yung DevPIDs nyo na I don't know po yung reason, pero usually naman yung mga DevPIDs work with at a team ng child neurologist, psychologist, therapist, and child psychiatry. Usually ganun po kami.
Okay, thank you. From Cora Mariano. Good afternoon po. My son always talks to himself when he's alone in a room. Is that a serious matter? We just ignore it every time. He doesn't want to use his hands also or get wet. Even after he poops, he just uses the bidet and not touching his puwet.
Okay po. Those, yung not using his hands, those are symptoms of obsessive compulsive disorder, ma'am. Yung na-mention ko kanina. May gamot po para dyan. Now, yung talking to self, that's another sign or symptom na meron po siyang auditory hallucination. Lalo na po kung madalas. Yun.
Okay. Si Christy Zoico Reyes naman, ang anak ko po ay 5 years old, PDS, no? And 5 years old and 10 months. At na-diagnose po siya may AMLM4. Well, at the hospital po, napansin ko po siya na bakit po kapag umiiyak siya at tingin ko po ay di lang niya makuha ang tulog niya, ay bakit po kaya pilit siyang may itinuturo sa isang lugar na para bang may makikita siya at di naman po niya masabi. Ano po kaya may tutulong niyo regarding po sa sitwasyon na gano'n?
Okay. Ma'am, yung dinescribe niyo naman is a scenario na ang bata ay very possible may visual hallucination. Okay po. Visual kasi tinuturo na niya. May nakikita siya na kakaiba. Siguro nakakatakot yung nakikita niya. Kaya tinuturo niya sa inyo and umiiyak siya kasi takot na siya sa nakikita niya. Pero since hindi niyo nakikita, nagtataka kayo ngayon kung ano ba yun. Now, marami pong causes ang visual hallucination din. Pwedeng delirium, nangyayari po yan sa maraming tao. Or kung magpe-persist talaga ng matagal, ay kailangan nyo na talaga ng consult. Yun po.
Yun, salamat po. Siguro dahil wala tayong mahabang oras, mag-entertain na lang ako ng isa pang question from the audience. Ano bang question natin dyan? Ito kay Jemima Christine. Good afternoon po, Doktora. After na mga 18 years old, ang anak ko na may Down syndrome, experiencing na po ng mga sinasabi niyong symptoms like sleeping disorder, nagsasalita mag-isa, may imaginary friends, nagtatantrums, sinasaktan ang sarili niya, sumisigaw ng bigla na di mo alam. Pero kapag nasa labas po, ay behave naman siya. Nangyari lang po na magkaroon ng pandemic, nag-aaral po siya.
Yung mga minention yung problems, Ma'am Jemima, ay talagang kailangan na po talaga yun ng consult. Tapos ma'am, isa pa po kasi na malaking pagbabago sa ating lahat kahit po walang Down syndrome nakakos ng stress ay yung COVID-19 kasi I am sure po yung mga therapy po ninyo ay na-disrupt lalo na po nung 2020 pero ngayon I'm sure nasa online na po ang mga therapy. Since na-disrupt po ang mga buhay ng mga tao, Well, nag-intensify din po ang mga symptoms na dinescribe nyo.
Okay, thank you, Doktora. At marami pong salamat sa mga katanungan at sa mga kasagutan na ginawa ni Doktor.
Ay,
Na-mute ka, Cesar.
Nakamute. 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 Nakamute ka, Cesar. Nakamute.
ay,
I'm
nawala po siya.
Yeah.
Yeah.
okay na?
Yep.
Okay po.
Okay na. So maraming salamat sa mga katanungan, mga kasagutan, at komentaryo. No?
Sir,
Siguro.
kung
Yes,
meron pa akong mga questions na hindi ko nasagot, pwede niyo po i-forward sa akin, sasagutin ko in my spare time.
Ayun, maganda yon, ha? Pwede pong mag-forward ng ano. Sige, no? Or pwede nyo i-forward sa DSAPI, pa-forward namin sa kung ano, mas madali yung ganun. So, before we really let go, si Dr. Vanessa, ang by way of closing the open forum, maganda yung mga sinabi niya, no? As parents, meron pala tayong dapat gawin, no? Take care of ourselves to begin with before we can take care of our children with Down syndrome and with mental health issues. So, yun ang mahalaga. So, on that note, and by way of closing, I'd like to ask the three panel members to give their brief closing remarks about this Kapihan.
Siguro, Cesar, let's bring back last words of encouragement muna from the doctor.
Sige, okay.
Yeah.
Okay. I know po that taking care of a family member with Down syndrome involves so many challenges. But I am sure that it is you, the parents, who are experts with regards to your child's behavior. We as mental health professionals are just here to assist you. Thank you po.
Salamat, Dr. Vanessa. At dako naman tayo sa panel members. Parting words?
Sige, mauna na ako.
Sige, Malu.
Yeah,
Malu, tapos
Vanessa,
Luis.
thank you so much. Vanessa, Dr. Vanessa, thank you so much for all the info that you have imparted to us, no? And it's really it's giving us awareness, and parang it's kind of liberating knowing na we are not alone. Marami pa lang, just listening to all the questions from our viewers, hindi pala sometimes we think kasi na there's something strange about my child, no? Akala natin nag-iisa lang siya, pero medyo meron palang common kaming mga problemang na may karanasan kaming problema na pare-pareho, no? So I think this our webinar today is very helpful. It's helpful for me, especially na knowing that ayoko sabihin na normal, na it's normal for these children to experience this, but it's so good that there is help that we can get also. Thank you so much.
Thank you. Ed Sanchez.
As a parent, Doktora, and on behalf of my wife Maricel and my family, thank you very much, Dr. Vanessa, no, for sharing unselfishly sharing your time and expertise with us this afternoon. Napakaraming. Kinakabahan ako, Doktora, baka may 1/4 sheet of paper eh. Pero nakakatuwa dahil I agree that sabi ni Luis behind the scenes, sabi niya, buti na lang hindi ako nag-doktor. Yan. But kidding aside, Doktora, we learned so much from you. We know we cannot capture everything in just one session. So we have now opened the doors, Doktora. In fact, the association is initiating a survey, Doktora, sort of a census, to uncover ano pa ba yung mga concerns na hindi natin na discuss or hindi natin nasagot in this session. On a personal note, ang take ko naman doktora dito, nasabi mo na rin, this is a combination of physiological, social, behavioral, and spiritual. We have a perfect God. Yan. Siguro, doon tayo magsisimula. And a perfect God does not make mistakes. Sometimes we don't understand why He allows things to happen, but He allows things to happen for a divine purpose. I said on a personal note, to all those who are listening and to the panel, to Doktora, we are in a work in progress as a family. Napakarami na po naming in 30 years, napakarami na po naming natutunan kay Micaela, our angel in the house. Unconditional love, patience, setting priorities, making sacrifices, empathy, and being able to see and feel what others are feeling and seeing, strength in certain circumstances. We also learn to pray. I mean, when we pray na talagang we really talk to God and put our trust in Him and remain faithful in spite of yung circumstances. Kasi maraming ma-encounter tayo. Every now and then, one issue will be solved and another will crop up. But I believe God will see us through and He will guide us if we continue to be aligned with Him. And with us as a DSAPI family, tayo lahat nandito. The organization is here to help. Then, with the help, of course, si Doktora now represents not only yung psych doktora kasi lahat ng mga healthcare professionals, maraming salamat, represented this afternoon by Doktora, who are reaching out to help our kids. So maraming salamat po sa lahat. And God bless po. God bless.
Thank you, Ed. And President Luis Harder.
Okay. Kaming mag-asawa, Dr. Vanessa Kayong, papasalamat po kami sa inyo. Personally, dahil po mabuti na lamang at nakilala namin kayo dahil nakita po kami ng malaki po yung improvement ni Adeline. And salamat sa iyong pangangalaga sa aming anak. No? And siguro naniniwala din ako na kaya nandito tayo ngayon at nagkakilala tayo para matulungan din natin yung ibang members ng Down Syndrome Association of the Philippines. Kaya maraming salamat po, Dr. Vanessa Kayong, at sa lahat ng mga audience. Naniniwala ako sa lahat ng mga tinuro sa atin ni Dr. Vanessa. Marami tayong napulot at ito yung magiging gabay natin sa tamang pangangalaga para sa ating mga anak na may Down syndrome, lalo na kung meron tayong napapansin na kakaiba sa kanila. So, malaking tulong ito sa ating asosasyon, malaking tulong ito sa ating mga members. And ano lang po, no? Yun po yung magandang takeaway natin ngayon. Seek medical, professional medical help para po matulungan agad natin at mabigyan ng lunas, karampatang lunas agad ng ating mga anak. So maraming salamat, Ed, Malu, Cesar, sa lahat ng ating mga audience. Abangan pa po ninyo at marami pa po tayong parating na mga webinars at sa ating sponsor na Fake Roots and Family. Thank you so much and God bless us all.
Thank you. Dito po nagtatapos ang ating kapihan. This is Cesar Baltasar, your moderator for today, now signing off. Thank you and good day.
Thank you. Thank you.
My name is Tony Pasha. I'm the proud father of Vicky Lou. She's turning 31 years old. Vicky Lou was born February 8, 1991. Fast forward 4 months later on, by God's grace, we met the Wamsleys. And I guess that was the first time that we really felt good in the sense that we were talking to another parents and pouring our heart out, that even if we were crying, nobody would tell us why we are crying. We finally met the 8 couples who constituted the group of the initial founding members of the Down Syndrome Association. It's truly a blessing to find and meet other new parents who journeyed in the same road as we did and found peace and acceptance, and most especially that our children are doing well.
When you're expecting a child, especially your first child, you get excited and you have all these plans and all these dreams, and then suddenly you find out that that isn't going to happen. You find out that your son, your child, has Down syndrome. I did not find the Down Syndrome Association of the Philippines. They found me. What did the association do for my son and for us? They gave us hope. How did they do that? They gave us answers to our questions.
I realized early on that the patients want to talk to another patient. At one point, they don't like to talk to doctors, but they want to talk to patients who probably had their daughter or son, and exactly how did they cope as a family. With the help of my first group of patients, the Wamsley family and the Pasha family, the Down Syndrome Association was born. Together with other parents and other professionals, we put it together as a way of helping up the patients out there.
We had the privilege of meeting the founding members of DSAPI during an early intervention seminar held sa gazebo ng San Lorenzo Village Park. And mararamdaman mo talaga yung sincerity and concern nila. Fast forward, 28 years later, I'm still with the Down Syndrome Association of the Philippines. Feeling ko parang ito yung calling ko. This is where our dear Lord wants me to be.
2006, they were looking for volunteers for the Happy Walk in North EDSA. And then, ever since, parang it's always been an annual event for me to help out in Happy Walk. In an organization that's for PWD, you seldom see guys, you seldom see dads. Sa DSAPI, it's all dads. Equal sila ng mommies and daddies. They really participate.
Dahil po sa DSAPI, nagkaroon po kami ng kaalaman tungkol sa pag-aalaga at pagpapalaki kay Kuya Renz. Through their program, Early Intervention. Kaya naman po, ini-encourage namin yung mga new parents with newborn babies with Down syndrome na maging miyembro ng DSAPI para po sa mga concerns and other questions na gusto nyo magkaroon ng katugunan.
If you are having a hard time accepting your child's condition, if you have reservations or apprehensions, a lot of those feelings will melt away and you'll start to feel relieved because through this seminar, you will understand more. And the more you understand, the easier for you to accept.
My concerns raising a child with Down syndrome is I feel I'm not equipped to take care of a child with special needs. Aside from that, my concern is how the world will treat them. But all my fears and anxieties started to disappear when I realized that there's so many moms like me out there in DSAPI who probably share the same fear. But when I saw them, how they raised their children, I was so inspired. And I said to myself, I can be as tough as them. Gagayahin ko sila. Life is full of twists and turns, ups and downs, and it's up to each of us to define its meaning. All I know, His plans are better than ours. It's okay to cry sometimes. The feeling of doubts, fears, guilt, they are all valid, but they are also temporary. Whenever you land in that space, keep in mind you are not alone. Trust yourself, your motherly instincts, and trust your baby because they will definitely will not disappoint you. Is this journey easy? No, but it's so worth it.
As we celebrate the 30th year of DSAPI, We are thankful that DSAPI existed when our son Jeremy was born 25 years ago. Since then, we have been active in DSAPI together with my wife Agnes and continue supporting its mission for all who need to know more. DSAPI is quite unique because we are mostly volunteers and mostly parents. And when we talk with new parents, it's very different when we can look them in the eye and tell them that we have been there and we know what they are going through. We hope and pray that all people understand, accept, and love our children. This is all they need, and this is all we ask for.
Mahirap bilangin at alalahanin ang magagandang nagawa ng DSAPI para sa ating mga anak na may Down syndrome at sa ating pamilya. Subalit sa abot ng ating makakaya at sa kagandang loob ng Diyos, ipagpapatuloy ng DSAPI ang kanyang mabubuting adhikain para sa kapakanan ng mga taong may Down syndrome, sa kanyang pamilya at sa kanyang komunidad.
Look at the child as a child first and his disability second. Love the child unconditionally and the child will bloom. To this date, I can attest the many gifts that our children has given to us and to a lot more other parents.
Natatanging nila lang sila. Kung may experience lang sana ng mga parents or relatives or friends yung pagmamahal o yung pagpapakita ng pagmamahal ng isang bata o isang taong may DS.
Never lose hope. Naipakita naman natin, talagang meron naman talagang pag-asa at may nagagawa naman talaga ang mga pasyenteng merong Down syndrome. So together, let us give them hope because there is hope.
If you have a child with Down syndrome, give your son a chance for a better future. It won't hurt. It can only help. Call the Down Syndrome Association office. Believe me, it'll change your lives and make your child the best that he or she can be.
It was by God's grace that He brought us all together. I would like to greet the many parents that we have met. This is truly a big celebration for our association, a big milestone. And we have a lot of things to be grateful for. So mabuhay ang Down Syndrome Association, mabuhay ang ating DSAPI family.
Sa mundo, sa pag-ibig ng magulang ko, tadhana ang gumalaw, sa kondisyong umibabaw. Pero kahit na papano, mahal na mahal ako, alam ko. Sa hugis ng aking muka, bukod tanging katangian, ngunit hindi ito hadlang sa aking wagas na pagmamahal. Ito marahil ang kaibahan, iba kami sa karamihan.